You'll be treated with ultrasound-guided sclerotherapy on the right and endovenous catheter ablation and phlebectomy on both sides. The ultrasound specialist is going to map out the course of the great saphenous vein. She identifies the vein along its course and makes these little dots with a straw so she doesn't ruin her probe with an indelible marker. She then simply connects the dots and draws a line showing me the course for my local anesthetic. As you can see, I've already marked the bulging veins that will be removed. Nitropase is applied to the insertion site in an attempt to dilate the great saphenous vein and to prevent venospasm. I then use a vein light to identify all of the veins that I want to remove and the entire course, as that course will change somewhat when the patient is placed in the supine position.
We're going to image the great saphenous vein at the insertion site in the transverse and then longitudinal. In this vein we're using a micro insertion needle, a 21 gauge. The wire then is then inserted into the great saphenous vein and advanced. Remove the needle, enlarge the incision site to about 1 millimeter to 1.5 millimeters. A little more local anesthesia around the vein. Now I'll put a larger wire in, advance through the sheath into the great saphenous vein. Under ultrasound guidance, the tumescent anesthesia is going into the great saphenous vein sheath, and you'll see the tumescence coursing up the sheath. We're also creating a significant cushion between the vein and the catheter and the skin overlying to prevent any thermal damage to the skin.